Good afternoon. It's Saturday. It must be time for the senior moment. This is Connie Clark with Home Helpers. And this afternoon, I've got someone very special in here. I have been trying to get her to come in here and talk to me for several months now, and we've finally been able to get our schedules together. It's Dr. Emily Petersen, and she is a nephrologist with Rockwood, and she's located in the 700 building across the street from Kootenai Medical Center. Welcome.
Thank you.
I heard you talk several months ago. Gosh, it seems like forever ago. But your talk was what you eat and how it affects blood pressure. And you made some really interesting points so far as the things that we don't even think about that we're eating, what it does to the insides of our body. And it made a big impression on me and the way I eat now. And I'm not sure that my husband likes it, but it's also the way he eats now. And so I wanted you to talk about some of those things today because it is really important. And so let's start with something very, very basic.
Okay.
What is blood pressure? What is it measuring?
So blood pressure is the pressure that blood exerts on the inside of blood vessels. So when the heart pumps, it pumps out a big bolus of blood. And when it pumps and the blood comes out, that's your systolic blood pressure,
Which
the upper
is
number.
the top number. Okay.
The upper number, yep. And as the heart relaxes and the blood moves through the arteries, the bottom number, the lower number, is when there's the least amount of blood going through the blood vessel. So that's the diastolic blood pressure.
And that's a pressure monitor like we would monitor the pressure in our tires.
Right.
Correct?
Right.
Okay.
Exactly.
If we
Yes.
can kind of make an analogy of that. So it's the amount of pressure on our blood vessels that we're seeing.
Exactly. Yep.
So just like on a tire, you don't want a higher number because it's going to blow out the tire.
Exactly.
Correct?
Yep.
And you had talked about a number of things that affect that number. And you said that what it is actually, your food and everything is actually doing is it's making your blood vessels harder. Is that a good way of saying it?
Yeah, so long-standing high blood pressure or a really high pressure on that arterial wall. It's a muscular structure. The artery is muscular. There's muscles
that's a muscle.
inside. Yes,
Okay.
inside the arteries.
Okay.
And with higher blood pressure, that muscle gets exercise and it gets harder. It gets thicker.
Like our
and
six-pack
wider.
abs.
Yes, exactly. Like our six-pack abs.
Like
So
somebody else's six-pack abs.
Yep.
Okay.
So it gets thicker and wider.
Okay.
And as a result, when the blood comes through the blood vessel, it exerts more pressure because it's working against a stiffer outer lining. The other things that can affect blood pressure are things like cholesterol and calcifications of the artery.
And that
So
stuff inside.
inside the walls of the artery.
Okay.
Yeah. So as you age, you get more calcium deposits inside the arteries, and that causes hardening. And so what you'll see is when that bolus of blood comes out of the heart, when there's a heartbeat, the blood comes out and it's exerting pressure against something that's very stiff and
It's
not
not
flexible.
moving.
It's not flexible, yeah. And so it doesn't move. So the pressure gets very, very high. And then it doesn't collapse like it's supposed to. So the bottom blood pressure, instead of the artery collapsing on the blood and maintaining a certain amount of pressure, the artery doesn't collapse, it just stays open. And so the bottom number gets very, very low. So as you age, as you get more calcium, as you have high blood pressure for longer and longer period of time, you'll see a marked difference between the upper and the lower number. So the upper number will go higher with a stiffer blood vessel, and the lower number will go lower.
So you might think, oh, well, my blood pressure is not that bad. Yeah, the first number is high, but the second number is real low.
Exactly.
That's not a good thing.
That's not a good thing. That's a sign of diseased blood vessels.
And those two numbers should be relatively close to each
They
other?
should be relatively
Okay.
close. Yeah. So the ideal blood pressure no one really knows exactly what an ideal blood pressure is, but we think it's probably somewhere between 120 and 140 on the top number. And on the bottom number, probably somewhere between 70 and 90.
Okay. So if you had a 140 over 40, that'd be an issue.
That would be an issue. That would be indicating very stiff and calcified blood vessels.
Okay. And you had mentioned something about calcium. And I just recently, within the past week, heard a friend who had gotten too much calcium in her system by accident. She was taking Tums.
Yeah.
I think she was taking 4 or 5 Tums a day, plus calcium supplements, plus calcium in her multiple vitamin, and her kidneys were about ready to shut down. Now, is that the kind of thing that would, the calcification of the vessels that you're talking about, that would cause it?
That not so much.
Okay.
It's more of a consequence of long-standing high blood pressure and scar tissue kind of building up in the blood vessels themselves.
Okay.
The high calcium that you can get from taking in too much milk or taking in too much Tums or things like that, that's more of a more of a short-term problem.
Oh, okay. Okay.
If you have long-standing high calcium, maybe over years and years and years and years of time, you can get calcifications.
Okay.
But more often,
so that
it's
wouldn't, that's not, okay.
No, that's kind of a separate.
Okay, so the calcium that is in your veins, is that the same calcium that's in your bones?
Yeah.
Okay. And it just doesn't go to your bones, it stays
Exactly.
in your
Yep.
in your veins.
Yep.
Okay.
It's more like scar tissue. Scar tissue can have calcium in it. So it's like long-term damage. You get calcium deposits in areas of long-term damage.
And if you've got that, what can you do about it? Is there anything you can do to get rid of that, or is it just there forever?
Well, it usually, if you've developed that, there's not a whole lot that you can do to get rid of it, aside from making sure that you're managing your blood pressure to avoid it getting worse.
So
What
other
we wanna
things.
do, yeah.
Okay.
What we want to do is prevent that from happening in the first place.
Okay.
So what we want to do is make sure that blood pressure stays in the normal range throughout your entire life. As long as blood pressure stays in the normal range throughout your entire life, that problem probably won't develop, at least not to the extent that it would if you had high blood pressure for your
Okay.
whole life.
And you had said that, the cholesterol and the calcium and all of that. But when we talked over at Garden Plaza when you did this presentation, one of the things you mentioned was sodium.
Yeah.
And the things you described of what sodium does to your body really made a whole lot of sense.
Yeah, sodium is critical in blood pressure and blood pressure control and blood pressure management. Now, there's been a few articles out lately about salt being good for you. And I don't know if some people might have seen those out in the press. And salt, in certain people, it's not wise to restrict salt too much. So in young people, young healthy people, it's not absolutely critical to follow a low salt diet. And by low salt, I mean less than 2,000 milligrams a day.
Now, what is 2,000 milligrams? Because you gave this
Yeah.
analogy, and I thought, oh my goodness, that's a, because 2,000 you think, wow, that's a lot, but it's not.
No, it's not. So in a teaspoon of table salt, there's 2,400 milligrams of sodium.
Okay, and so we're talking a measuring teaspoon, not a heaping full teaspoon like
Right.
you would make your hot chocolate from a teaspoon.
Yes,
Okay.
exactly.
Okay.
A flat measuring teaspoon.
Okay.
2,400 milligrams in that.
So that's even more than a day.
That's more than you need in a day. Yep. Most of the salt in people's diet, in the American diet, comes from food processing. And that's on the order of about 80% of the salt in the average American diet. The average American eats about 4,000 milligrams of sodium a day.
And that's average.
That's average. And that's more than anybody needs.
Oh, yeah.
It's more than anybody needs. There's absolutely no one aside from a few very rare medical disorders who would need more than 2,000 milligrams a day of
Well,
sodium.
and I remember way back when I was little, in the summertime, I was out helping my dad, and we were just sweating profusely, and you used to take salt pills.
Yep.
Because you sweated so much out of your body.
Yeah. And that's still recommended
Okay.
for exercise, for people who run marathons, for football players out exercising for several hours in the hot sun. You'd still recommend salt tablets to replace the electrolytes that are lost during real vigorous
Right.
physical exertion. And that's kind of an exception to this scenario.
Okay.
But the average person
No.
doesn't do that.
No.
And so the average person with an average amount of physical activity during the day, there's really not very many people out there that need much more than 2,000 milligrams a day of sodium.
And explain what sodium does to your body.
So it does different things to different people. If you're young and healthy and have no problems with high blood pressure, normal kidney function, no organ problems like heart failure, liver failure, or anything like that, your kidneys get rid of it. It doesn't do much to you. So you could eat 10,000 milligrams a day of sodium. Your kidneys will probably get rid of it just fine. Your kidneys are very accommodating organs to diet indiscretions. So they'll just get rid of the excess. But in people who have a bit of high blood pressure, people who have maybe their heart doesn't work quite as well as it should, people who have a little bit of scarring in their kidneys, a little bit of chronic kidney disease, those people don't get rid of sodium like they should.
Okay.
And when you start to retain sodium, because the kidneys aren't excreting it like they're supposed to, sodium hangs on to water. And when you have an excess of sodium in the body maintains your sodium concentration at a very, very narrow range. So your sodium level in your body, the concentration is always going to be approximately the same. And it does that if you have a high sodium level in your body by retaining water. So the sodium attracts water, which increases your blood volume, which increases the pressure that blood volume exerts on the blood vessels, which increases
Let
your
me back
blood
up
pressure.
because in my little brain, when someone would say, well, I'm retaining water because I had too much salt, I would see it in I couldn't get my ring off my ring finger or my
Exactly.
feet would swell.
Yeah.
You don't think of it in your blood vessels. You think of
Yeah.
it in the
In your
muscles.
tissues,
Yeah, in your
yeah.
tissues.
And think of all of that swelling that you're seeing in your tissues is also going on in your blood vessels. That's why it's leaking out into your tissues, because there's so much volume, so much pressure on those blood vessels, those small capillaries, the veins, that it leaks out.
So it's not
Into
going the
your
opposite tissues into the blood.
No.
It's from the blood out into the
Yeah.
tissues. Okay. That picture? All right. So then what that does, let me back up. The salt increases the amount of water retention, and that's going on in your blood vessels.
Mm-hmm.
So then that puts more pressure on the muscle walls of your veins because there's more liquid going through your veins. Is
yes,
that correct?
there's a larger volume, and so they're having to hold on to a larger volume. So it's like you're filling your tire up with too much air.
And it's one of those really hard tires.
Yeah,
And now the pressure's
and
really
now the
going
pressure's
crazy.
just shot right up. Yep.
Okay.
And so there are a few people who can get away with a lot of salt, but I wouldn't recommend a lot of salt for pretty much everybody. There's really not any need to eat a high salt diet. There's no benefit. There's no dietary benefit or health benefit to eating a very high salt diet. There is probably a health benefit to eating a low salt diet, even if you don't have those problems like kidney disease or heart disease or high blood pressure. And there is definitely a health benefit to eating a low salt diet if you do have those problems.
Is there a medical condition that would happen inside of you if you didn't have much salt?
If you ate an extremely restrictive diet, so people who get like a GI bug, like nausea, vomiting, diarrhea, and the only thing that you can keep down is water, so you eat a very low, what we call solute diet, so no food and just water. You can actually get dehydrated if you drink water alone. You have to have a certain amount of sodium, a certain amount of electrolytes in order to keep yourself hydrated. You need solute, you need food and electrolytes in order to keep yourself hydrated. Water alone doesn't do it.
And that, what you said kind of makes sense because I've been in situations where I can't really eat anything and they don't tell me just have water. They say drink bouillon. And when
Yes.
and looking, I did some investigation before we talked and looking at the sodium content of bouillon, it's huge.
Yes.
So that's why the
That's why they
bouillon is
recommend that.
okay.
Yeah. Yeah. So if you're dehydrated for whatever reason, it's the same thing. It's the same thing that happens to the marathon runners and the farmers and the football players. You're losing all of this solute in your nausea, in your vomit, and in the diarrhea. You lose all this solute, and that makes you dehydrated. You can't rehydrate with water alone. You have to rehydrate with some amount of solute.
Because the sodium makes your body retain that water that you're drinking.
Exactly.
Oh, makes
exactly.
sense.
You've connected. Yeah. That's great.
Otherwise, it's just
Yep.
going out and none
Yep.
of it's staying in your
Yeah,
body.
it doesn't stay. Yeah, it doesn't stay.
Interesting.
Yep.
Oh, I learned something today. And so back to the thought of you just have that one little teaspoon, which is 2,000 milligrams. That's not a lot compared to when you start looking at labels
Right.
of what we're eating in our
Yeah.
diet.
Yeah. Anything that will sit on your shelf for more than a couple of days without going bad is packed with sodium and packed with preservatives. And sodium's the most common preservative that people use. And in
That's
addition,
because it makes everything retain the water, right?
Yes.
It's making too much sense now.
In addition to being a preservative, the American is used to a lot of sodium, and so our taste, our sense of taste, has kind of accommodated to a very high amount of sodium in the food that we eat. So it's kind of for reference. If you are in general eating about 2,000 milligrams a day of sodium, and you eat that on Tuesday, and then on Wednesday you eat 10,000 milligrams of sodium that day, the food's going to taste salty on Wednesday. If you eat 10,000 milligrams on Thursday and Friday, by Friday that food doesn't taste salty anymore.
You
It
become
tastes
accustomed
normal.
to it.
You become accustomed. And then when you cut back down to 2,000 milligrams a day,
It tastes bland.
food tastes bland. And so the American, eating an average of 4,000 milligrams of sodium a day, has become accustomed to that amount of sodium. And so the food industry has accommodated our taste and added excess sodium to everything that is processed. So all of those pre-made dinners, in addition to using it as a preservative, they're also using it to flavor the food.
To
because
make it
that's
taste
what the
better.
Americans demand.
Exactly.
Yeah. And so like a Stouffer's dinner, not to drop name brands or anything.
Oh, I'm going to
but
drop some names here.
Stouffer's or Marie Callender's or anything, any
Right,
of those
the
frozen,
frozen
dinners
dinners.
that you eat, they're going to have around 1,500 to 1,800 milligrams of sodium per serving, per
So that's all you
meal.
can have for the whole
For the
day.
whole day. Yeah. There's enough sodium in food as it comes out of the ground to keep all of your body processes going. So if you're eating apples and if you're eating vegetables and
Eating
and
your fruits and vegetables.
and regular
Right.
food, just as it comes out of the ground, there's enough sodium in those foods to maintain all body functions and not have to worry about adding sodium to anything.
Well, I want to keep talking about this because I've looked up some foods that will no longer be on my shelf after they're gone this time. But I want to continue this conversation, so we will take a break. We'll be right back. Yeah, that's where you hit me is when you started talking about all the foods. I'm going there. And then in going through this, there's some things I love to eat that I can't,
Yeah.
like olives. I could eat a jar of
olives and pickles and
garlic stuffed olives.
yeah, it's good stuff.
Okay.
Okay.
You ready to start back?
Sure.
Okay. And welcome back. Again, this is the Senior Moment, and this is Connie Clark with Home Helpers. And I have Dr. Emily Petersen with me today. She's a nephrologist with Rockwood here in Coeur d'Alene. And we've been talking about blood pressure. First, we defined what it was and understood what it's actually measuring. And it's actually measuring our tire pressure inside of us, so to speak. And then we started talking about how sodium affects those blood vessels and all the different foods that have high sodium in them. And it's crazy because, we talk about that they use sodium to preserve things. And it was probably not a bad thing when people were coming over in covered wagons and they walked all day.
Right.
And so they needed that extra sodium so that the salt that they used to preserve their foods at that time, that was actually a good thing.
Yeah.
That it helped
served a
them
purpose.
not to dehydrate. But we're still using sodium to preserve our foods, and we don't need all that salt anymore.
No, we're much more sedentary than we used to be.
And you were talking about how the more sodium you eat, the more accustomed your taste buds get to it. I know in seniors, as they get older, they lose their sense of taste.
Right.
And so they really go after salty things and sweet things because they can still taste that. Real salty and real
Right.
sweet versus things that, normally you wouldn't eat that salty. That's what they'd eat. And my brother-in-law is an example of that. He has high blood pressure, he has diabetes, and he'll put ketchup in his plate and put like a teaspoon of salt in the ketchup.
Oh.
And when I was, yeah, I know. When I was looking all this up, ketchup is one of those really high sodium foods
Yeah.
anyway.
It's surprising.
So for him to have to add the salt to the ketchup is just crazy. I mean, I looked at this
Yeah.
number and it was just, oh my gosh, amazing. And looking all these things up, it was talking about in here some of the worst foods that have sodium. And of course, you would think table salt, but it also said baking soda and baking powder, and I didn't realize there was
Yeah.
salt in those.
Sodium bicarbonate. Yeah.
And so that's still the same sodium that's in your
Same
body.
sodium. Yep. It's sodium chloride in table salt and sodium bicarbonate in baking soda.
Those two things. And it was bouillon, which I had mentioned before, and soups, like your Campbell's soup. I mean,
Oh, yeah.
it I think it said it had like 900 milligrams per serving
Per
in this
serving.
can, and this can was 2 servings.
Yeah.
And who eats half a can of soup? You know?
Right. And even the low sodium
It's still
Campbell's,
500.
Well, yeah. It can be up to 1,200 and the low sodium. Yeah.
And it is low
for a can.
compared to what it was.
Right. Exactly.
And those cans are 2 servings, so you eat the whole can.
Right.
I mean, there's your whole day there.
Yeah.
And it was talking about processed foods like salami and bacon and ham. Had a
Yeah.
huge amount of sodium in it.
Right.
Not to,
Processed
you know,
meats. Mm-hmm.
with the holidays coming up and stuff, a lot of people have ham for that, but it's really high in sodium.
Yeah, you have to be careful, very careful, if you have any degree of kidney disease or high blood pressure or any degree of heart disease. A salt load like that, like Christmas dinner, you're going to notice swelling in the morning. Even
Now-
healthy people might
Now,
notice
if you
swelling.
have those kinds of diseases and you eat a huge meal that's 10, 12,000 milligrams of salt, could that put you into cardiac arrest doing something like that? Or
Probably not cardiac arrest, but it might cause you to go into, depending on how bad your diseases are, but it may cause you to develop fluid in the lungs. So congestive heart failure exacerbations, that kind of a salt load. I have patients that just one indiscretion, like going out to Chinese food for the night, will land them in the hospital the next morning with fluid in the lungs that we have to use IV diuretics to get rid of.
So is that the same fluid that started out in the veins that now went
Yep.
out to the tissues and now is seeped into the lungs? Is that what
Seeped
that
into
is?
the lungs, yeah. Just like it gets into your fingers and your feet, that fluid can go into the lungs and it causes very severe shortness of breath.
Because I would think, my little non-medical brain, fluid in the lungs, you'd have to be congested. Because I'm thinking of it coming from, I guess, an outward source,
The
but it
air,
can
yeah.
actually
Yeah.
seep in from your body.
Yeah. Yeah. So like a pneumonia generally comes from the outside, and
Right.
that's the same type of filling process inside the lungs, but it's bacteria and it's white blood cells in a pneumonia. But with heart failure, it's the same filling process. It's water from your blood vessels, though.
Oh my goodness.
Yeah, it's scary. It's scary.
So, and again, Chinese food's one of the things on the list here, and that's because of the soy sauce.
Yeah, and a lot of their sauces have a lot of sodium in them. Yeah, and preservatives, that type of thing.
Yeah, I think it said one of the things I saw was monosodium glutamate.
Mm-hmm.
Monosodium.
MSG.
Okay,
Yeah.
that's the sodium.
Yep.
Interesting, interesting. And they had also mentioned on here sun-dried tomatoes, cheese.
Cheese is extremely high in sodium. An ounce of cheese has over 500 milligrams of sodium in it.
Oh, all my good stuff that I like to eat here. And pickled foods. I was depressed because I love olives, and they're one of the highest ones on here. I could probably eat my entire day's worth of sodium in olives and pickles. And that, I
Yep.
guess that's because of the preserving.
Because of the brine. Yeah, the pickle brine. Yep.
Okay, and just thinking when you said brine, because I know my son-in-law it cooks and he brines chicken and stuff, and I guess that's infusing salt.
Yep.
So that's probably not a good thing that he does that.
Well, it's everything in moderation,
Okay.
right? So, if you have severe heart failure, severe kidney failure, it's probably not a good idea to ever eat those things. But as long as you're aware of what you're doing and you have relatively healthy heart and relatively healthy kidneys, you can accommodate some of those things into your diet on an occasional basis. What I usually recommend for people to follow a low salt diet or low sodium diet is make sure you're looking at labels. As a general rule, try and pick things that are less than about 150 milligrams of sodium per serving. If you pick things that are less than 150 milligrams per serving, you're very unlikely to exceed 2,000 milligrams a day.
So
of
is that
sodium.
what 2 or 3%? Because I also put the percentages on the side. So
yeah.
if it's
So I think the RDA on the labels is usually about 2,500 that they say on the label,
Right.
and so that's going to be a percentage of 2,500.
so it'll be like 5% maybe.
Yeah.
Okay, so don't eat anything more than 5%.
Yeah. Yeah.
Okay, and we've been mostly talking about the heart, and your blood pressure. Now you said fluid on the heart, so your heart would take on some of that fluid.
So when your body gets overloaded with salt and with water, when you have an excess of fluid in your blood vessels, it puts stress on the heart. And so if the heart's at all damaged, at all stiffened, or if the function of it isn't optimal, it gets backed up. That fluid gets backed up, and the heart can't keep up with it. And when
So
it
it's
starts,
backing up with blood.
it's backing up with blood. And the
Okay.
next organ in line is the lungs.
Okay.
That's the one that it backs up into. And so that fluid that the heart can't quite accommodate gets into the lungs and causes the lungs to fill up. And that's what we call congestive heart failure, when the fluid starts to back up from the heart into the lungs.
Oh, okay.
Because the heart just can't accommodate. Even if you have only mildly impaired heart function, or if your heart's stiff from years and years and years of high blood pressure and it has a thick muscle, thick wall, if you eat a high salt meal or really high salt meal, that can cause congestive heart failure and that fluid backed up.
I'd always wondered what that was because you hear about heart attacks and you hear about strokes, and I kind of understood what those were.
Mm-hmm.
But my mother had congestive
Yeah.
heart failure, and I really didn't know where that fit in all of that. And that's what it is. It has to do with the fluid
Mm-hmm.
backing up because the heart can't accommodate
The
it
heart
all.
can't accommodate it. That's right. Yeah. It can only accommodate so much volume in each beat, in each pump. And the fluid that can't be accommodated by the heart backs up to the next downstream organ, and that's the lungs.
And is that why when they're talking about symptoms of a heart attack and that sort of thing, shortness of breath is one of them?
The A heart attack and congestive heart failure are different things.
Okay.
They can be related, but they're generally different things. A heart attack is where so there are arteries that supply the heart muscle itself with blood. So the heart muscle needs blood in order to keep pumping.
Because it's a muscle.
Because it's a muscle, exactly. And so there are arteries that supply that heart. If those arteries get blocked off, either by a blood clot or by cholesterol plaque and narrowing from cholesterol, if there's a blockage of one of those arteries, that causes the area of heart muscle that it supplies, so that area doesn't get any blood flow. And so it starts to die.
Okay.
And when it starts to die, it hurts. It hurts very badly when muscle starts to die. And so that's where people get the chest pain and chest pressure.
Okay.
And that's a heart attack.
Okay.
Congestive heart failure can occur without a heart attack itself. Congestive heart failure can occur just from an excess of volume in the blood vessels.
Okay.
Okay. And they're very related, because a heart attack, if the heart's not pumping normally because
Right.
of a heart attack, you can go into congestive heart failure.
Okay. So then what would be the symptoms of congestive heart failure? I mean, is there an event or is it just a
Yeah.
long line of things?
It can be a slow process. It can be a sudden process too. Usually, what people will notice is swelling in the legs.
Okay.
Is the first thing that you'll notice, and your ankles will start to get puffy, and that's the first sign that you're starting to get some fluid overload. Usually, that happens well before you get fluid in the lungs. Fluid in the lungs is kind of later.
Okay.
But you'll start to notice fluid building up in the feet and the ankles. It'll spread up above the knees sometimes, and then you'll start to notice that you're gaining weight relatively quickly. It's not fat; it's fluid.
It's water weight.
It's water weight, exactly. And so that starts to build up kind of slowly. Can be quick, but usually it's pretty slow. And once it reaches a critical point, that point is different for everybody, just depending on how well your heart works and so on, how well your kidneys work. Then the lungs will start to fill up. When the lungs start to fill up with fluid, it gives people very severe shortness of breath. And it can cause wheezing occasionally. It can cause a dry cough, or a cough productive of just a little bit of clear sputum, kind of feeling like you've got a viral infection, but just really, really severe.
So if you weren't really paying attention to seeing your extremities swelling up, you would think you were coming down with something.
You might, yeah. You would probably wouldn't get a fever or anything like that.
I think
but
you had a cold or
you'd get
allergies
shortness
or
of
something.
breath.
Yeah.
Yeah, that type of thing. You might feel like that type of thing was going on. Yeah.
What would make it different than if it was just allergies? I mean, would the lungs continue to fill up more and more and that you really couldn't breathe? And
Yeah, with allergies, generally what you'll get is sinus kind of stuffiness, itchy nose, itchy eyes, kind of redness, a little bit of clear drainage from the nose. You might get a little bit of a cough, you might get a little bit of a wheeze, but the symptoms are primarily in the sinuses, in the nose, in the eyes. This type of process is really in the lungs. It's really shortness of breath. So it's less kind of in the sinuses, less in the face, and more in the lungs, where you just feel like you can't catch your breath. You know, you'll walk a block where you used to be able to walk a block no problem. Now you can only walk, 50 feet, 100 feet, and then you start to get short of breath and you have to sit down.
So, so there really wouldn't be any other disease type symptoms other than shortness of breath.
Shortness of breath and the weight
Would be it,
gain.
and the weight gain.
Yeah.
Okay.
Usually, I mean, the vast majority of the time, it's going to be preceded by swelling in the ankles. And you'll start to notice that you're gaining weight. Your pants are fitting tighter. Your socks are leaving a ring on your legs.
Okay.
That type of thing. You're going to notice that first.
So if you start seeing those kinds of things and you can't catch your breath, you really do need to see somebody
You need
for
to
that.
see somebody.
Because it's not a minor thing happening.
No, it can be very severe. Yeah.
And is it something that if you cut back your salt, it all goes away, or it doesn't?
Oftentimes, so cutting back on salt will help to prevent that type of thing from happening. And it's absolutely critical in patients with heart failure and with kidney failure, even mild heart failure, even mild kidney failure, that they follow a low salt diet. Because any kind of salt bolus, salt load,
Like you were talking about the Chinese
meal,
food.
any type of load like that, you can't get rid of it as easily as you could when you were 14. Where your kidneys could just accommodate that and urinate out all the excess sodium. Your kidneys just don't do that anymore as you age. And so that type of meal can put some people over the edge.
Mm-hmm.
So it's absolutely critical that you really pay attention to the amount of salt that you eat. And that's more of a preventative measure for that type of event. If that thing occurs where your ankles start to swell, where you start to get short of breath, where you start to get fluid overloaded, then we often need to use diuretics.
Need to do something now to get rid of it now versus slower.
Yep, and diuretics will make you pee out salt and water.
Okay.
And get rid of that fluid.
Right. Makes a whole lot of sense. Because like I said, my mother had that, but I really never knew what it was. And I probably would have really gotten onto her had I known what it was, because she ate those TV dinners at night all the time.
Yeah.
And cans of soup and things like that. So that's probably why she had the issues she had. So, yeah, I want to continue talking about this because you are just so interesting. I could probably sit here and talk to you for hours and hours. But we need to take a break, and we will be right back.
Yeah, and a lot of times, so the diuretics can be damaging to the kidneys.
Yeah, that's the next thing I want to talk about, because you've mentioned the kidneys on several, and we've talked about the heart, but that's another important piece of the whole puzzle.
Yeah.
So we're going on our last one. See?
All right.
Yeah, I mean,
Great.
we could just sit here and have a conversation. So, are you ready? And we're back. Welcome back to the Senior Moment. Again, this is Connie Clark with Home Helpers, and I have Dr. Emily Petersen with me this afternoon. She's a nephrologist with Rockwood here in Coeur d'Alene, and we started talking about blood pressure and what blood pressure was, and then talking about our diets and how excess sodium affects our heart and our lungs. And one of the organs that you keep mentioning in this discussion is kidneys. And you had said during the break that, we could put someone on diuretics to get rid of the fluids that are in the lungs and the rest of the tissues, but it could damage your kidneys. So tell me basically what do the kidneys do, and how does all of this affect them?
So I'm a little biased because I'm a kidney doctor, but I think the kidneys are absolutely
the most important organ.
The most important organ. Yep. They're absolutely critical in this whole process. The kidneys are responsible for getting rid of that excess fluid. And that's actually a huge part of what I do for a living is helping people manage their fluid balance. So low salt diet is absolutely first and foremost.
But not too low, because then you'll get dehydrated.
Only if you're not taking in any food at all. You can get all the sodium that you need in a daily basis just by eating regular food with no salt added.
Non-processed food.
Non-processed foods, yeah. You don't need to add salt to any food to get enough
But if you're
sodium
just
for the
drinking
day.
water,
Only water, you're going to get dehydrated.
Okay.
Yep. So low salt diet's absolutely critical in managing fluid balance. And just for clarity, I'm talking about people with heart failure and people with kidney failure. So if you eat an excess of salt on a daily basis, you're going to start to build up fluid. The way that we manage that excess of fluid is with diuretics. And a lot of people with kidney failure, a lot of people with high blood pressure, a lot of people with heart failure are on diuretics chronically. And that's to help the kidneys. It kind of augments the sodium removal from the body. So it helps the kidneys get rid of sodium.
Okay, so a diuretic doesn't necessarily get rid of the water; it gets rid of the sodium.
Gets rid of the sodium.
Okay.
Yep, that's how diuretics work. They
Okay.
help the majority of them. There's a few diuretic exceptions, but most of them help the body to get rid of sodium, and that's how
Okay.
they manage your blood pressure. That's how they manage your fluid balance. And water follows salt. So when you get rid of sodium, you get rid of water.
Then the
as
body
well.
doesn't hold on to the water.
Yep,
Okay.
exactly. You can very easily overwhelm the ability of a diuretic to get rid of sodium by eating a high salt diet. So you'll start needing higher and higher and higher doses of diuretics to manage your fluid balance and manage your blood pressure if you eat a high salt diet. Because those diuretics are going to have to get rid of more and more and more sodium. Okay, and you can overwhelm their ability to get rid of that sodium by eating an excess of sodium.
And if you go the opposite and eat not very much sodium at all, would it get rid of too much?
It could.
Okay.
And that's actually one of the downsides to using diuretics. So if one day or maybe for a week, you eat 5,000 milligrams a day of sodium, and you come into the office and we see that you have swelling in your ankles or some shortness of breath.
So it's not
some fluid
getting
in
rid
the
of as
lungs,
much.
You're
Okay.
retaining water, retaining sodium. Then we increase your dose of diuretics. And then you go a day where you don't eat much at all. You feel sick, you're not up for it. Kind of stay in bed all day and don't eat anything, but you still take your diuretics. Same dose as before. Then you pee as much as you did before, but you don't have as much to get rid of, so you end up dehydrated. If that goes on for a couple days in a row, you can get very dehydrated, which can result in very low blood pressure and kidney disease.
So that would make your blood pressure take a nosedive.
Exactly. So really the best way to manage, if you do have that problem with high blood pressure and heart failure and kidney failure, and you're on any kind of diuretic, whether it's just to manage blood pressure or to manage the fluid status, it's very, very important that you eat a consistent amount of sodium on a day-to-day basis. And that really should be a low sodium diet so that we can minimize the amount of diuretics that we need. But it should be consistent on a day-to-day basis. Because if you get sick and don't eat that much, you can get very, very sick if you continue to take the diuretics.
Okay. Again, I'm thinking back to my brother-in-law because we've always said to him, you need to cut back on your salt. You need to cut back. And he says, no, the doctor says I don't need to. Well, what I'm probably thinking is it wasn't that conversation you don't need to, but you need to maintain where you are because this is where your diuretics are.
Exactly. So if we set a certain dose of diuretics and then you go up on your sodium on that dose of diuretics, you're going to retain more water. And then we're going to up titrate your diuretics. And if you go down on your sodium from that point, you run the risk of getting dehydrated.
So he's probably hearing it as you can eat as much salt as you are now because we're going to keep your diuretics at this level. Okay.
We're going to keep going up and up and up on your diuretics.
Exactly.
Now,
Now, what does that do when you continue with the high sodium and you've got the high diuretics? What does that do to your kidneys?
So if so it kind of paralyzes the kidneys. So the diuretics do the work that the kidneys were designed to do. The kidneys do that job a whole lot better than the diuretics do. When you use diuretics, you paralyze the kidney's ability to appropriately manage electrolytes. And so when you use an excess of diuretics, you tend to get very low in potassium, very
Because
low
that's
in
flushing all that out of your body.
very low in magnesium, very low in, other electrolytes that are very important to the body. The acid level in the body starts to go down and your blood becomes very basic. So it's your acid level is low, so your body gets too high of a bicarbonate level with diuretics. All these things become abnormal when you're using an excess of diuretics instead of relying more on the native.
You're having a
kidney
chemical
function.
thing
You're
happen in
yes, it's an artificial thing,
Okay.
and it has consequences. It's not. There's no ideal diuretic that works the same as the kidneys work. The kidneys are a lot smarter than a diuretic is.
So is this as the analogy, now that we have a remote control and we don't have to get up and change the channel, we've gotten lazy?
Yes.
Okay.
Yes. And it's not a good idea to rely on diuretics because
Okay.
they're just not as good as the kidneys themselves. The kidneys can accommodate. So if you get a little bit dehydrated, so if you skip lunch and you get dehydrated, your kidneys will concentrate your urine so that you'll notice at 4 o'clock you haven't gone pee for 8 hours if you skip lunch. Your kidneys are concentrating that urine. They're hanging on to all that fluid that if you were on a diuretic and your kidneys weren't able to concentrate your urine, you would just keep peeing if you skipped lunch.
Okay. So, all right.
And you'd run the risk of getting dehydrated.
Okay. So if you're continually on diuretics, you will probably have to stay on them forever because your kidneys won't be able to.
It's only temporary.
Oh, okay.
So you can take diuretics off and the kidneys will recover. The kidneys will recover. They're very resilient organs. They'll
Okay.
recover. So it's not a permanent thing. So if you start a diuretic, you paralyze the kidney for the time that you're on the diuretic, which is 8, 12, 24 hours. But then by the time that dose has worn off, the kidneys started to work on its own again.
Okay, so let's say that you had kidney disease or some sort of problem like that, and you had to go and have dialysis.
Mm-hmm.
Is this getting rid of the fluid in your body? Is that what dialysis does?
Dialysis behaves like an artificial kidney.
Okay.
So you're hooked up to an artificial kidney. So what we do is we draw out the blood in your body through your vein. So we take the blood out at a pretty rapid rate, run it through this machine that has a filter on it. And that filter acts very much like the kidney does. It's not perfect. It's not as good as the kidney, but it works pretty darn well. And it draws off excess fluid, draws off excess potassium, draws off excess phosphorus, excess sulfates, excess toxins that build up in the body that the kidneys normally would be getting rid of. So it draws off all of those toxins and it draws off excess fluid, and then it puts the clean blood back in your body.
So when it says you're cleaning your blood, that's what it's doing, is taking the excess fluid.
Excess fluid, excess toxins, and removing all of them. It doesn't work anywhere near as well as a kidney does. We can only approximate about 10% kidney function with dialysis. But it works pretty well. I mean, kidneys are the only organ that we can replace with a machine.
And if someone has to go on dialysis, are they on forever or can they get off it?
There are certain situations where people, generally people with healthy kidneys who undergo like an illness, a severe illness like pneumonia or severe infection of any type, and they become very, very sick. People with healthy kidneys, their kidneys can shut down during that illness. A lot of times if that happens, the kidneys will come back.
Oh,
They
okay.
may require dialysis for a short time to support their body while their kidneys are shut down, but the kidneys will probably come back.
So if you're in a situation where you've been sick or something like
Hmm.
that, and they tell you you need to go on dialysis, don't freak out because that you're thinking that's forever.
Yeah,
It
it's
might
not,
come back.
well, it's not necessarily forever. The majority of people who end up starting dialysis are people who've had kidney disease for a very, very long time. It's been progressing for a very, very long time, and it's just reached the point where the kidneys can no longer
Okay.
support the body's functions
Okay.
that they need to support. And those people are going to be on dialysis, forever until they get a kidney transplant, which would be the ultimate goal. Um, and there are other people, there are certain autoimmune diseases of the kidneys that we can treat, and they may require dialysis for a short time and may come off of it. But a lot of times, these autoimmune diseases, when they get severe enough that people require dialysis, they usually don't come off of it. Sometimes it happens, but usually they don't. Um, so, the majority of time when people start dialysis, it is going to be a permanent thing, but there are certain situations where people can get off dialysis because their kidneys recover.
Okay. And what we were talking about then initially was blood pressure and how sodium affects it.
Mm-hmm.
And if you had a very high diet of sodium, 10,000 milligrams,
Mm-hmm.
5,000, for a long period of time, would that destroy your kidney to the point where you'd have to be on dialysis?
Yes, it could. So there's so much about genetics that we don't know. Certain people can get away with a lot more than certain other people. And I'm not going to say that everybody who eats 10,000 milligrams of sodium a day is going to end up on dialysis. That's just not the
Right,
case.
right.
But there are people out there who are prone to high blood pressure, who are prone to kidney disease, who are prone to heart failure. Those people, if you're prone to very, very severe high blood pressure and you eat a very high sodium diet, you're putting yourself at risk for kidney failure, heart failure in the
And
future.
diuretics may get you through now, but eventually as you progressively increase the dose, it may not work anymore,
It may
correct?
not work anymore, and you may suffer from severe dehydration on days where you might not eat enough. Those type of things. So diuretics are risky. They're not completely benign drugs. So you can rely on them for kind of the short term, but they're not something to be used in high doses for a long time. You're running a lot of risks.
So this diet that we've talked about our diet here on a number of occasions, but this diet that we have now where we are using sodium to preserve our food in cans, in frozen state, beef jerky, buffalo jerky, whatever, all of this sodium, yeah, when we were coming across with those covered wagons, it was a good thing to have. But we've continued to do this, and now look at all the fast foods and everything. We continue to increase the amount of sodium in our body, and it's actually destroying
Yeah.
the inside of our body.
Yeah, it's pretty toxic. It's pretty bad for you. And there's other reasons not to eat processed foods too. The preservatives that they use, the phosphate preservatives that they use, those in high quantities, phosphates in high quantities damage the bones. They damage the arteries on their own, and so you're just adding to the whole problem.
And you can't see it, it's all going on inside of you
You can't. Yep. And you're not even going to notice it for 10 years
until it's too late.
until it's too late.
Well, we have covered a whole lot of really, really interesting subjects, and we went beyond what I sat and listened to you talk a few months ago. I do have Dr. Petersen's number here in Coeur d'Alene. If you have any questions or have any issues that you may think something's going on, the office number over there is 666 9541, and she is with Rockwood, and she's also the medical director of Fresenius Dialysis. So she knows a lot about all of this stuff that we've been talking about. And also you can go online at coeurdalenehomecare.com if you want to listen to this interview again or listen to previous interviews. And thank you, Dr. Peterson, for being with us this afternoon.
Thank you.
You have really enlightened me, and if we can just help one person out there, it's well worth it.
Great.
Thank you so much. And you all have a wonderful rest of your weekend.